In emergency and high-pressure situations, veterinary nurses are trained to act quickly. Animals may be deteriorating, clients are distressed, and the team is looking to you for immediate support. But sometimes, the pressure to act can lead to a cognitive trap known as action bias. Action bias is the tendency to favor doing something, anything, over doing nothing, even when waiting, gathering information, or escalating would be the safer choice. In veterinary nursing, this bias can influence decision-making in subtle but important ways. Action bias often comes from good intentions. We want to relieve suffering. We want to help our colleagues. We want to reassure clients. And we don't want to appear passive in an emergency. However, the urge to act can override careful thinking, clinical protocols, and scope of practice. High stress, time pressure, fatigue, and emotional situations, such as critical patients or upset owners, all increase the likelihood of action bias. Consider a triage scenario. A dog arrives breathing rapidly and appears anxious. Instead of quickly alerting the veterinarian and preparing oxygen as per protocol, a nurse might spend valuable minutes attempting a full set of vital signs first because it feels like taking action. In another situation, a nurse might provide detailed advice over the phone to a panicked owner, rather than prioritizing instructions to come to the clinic immediately and escalating to the veterinarian. Action bias can also lead to performing tasks outside authorized scope, attempting interventions without direction, or delaying escalation because we believe we can manage the situation ourselves. While action bias comes from a desire to help, it can lead to delayed critical treatment, missed warning signs, increased patient stress, safety risks for staff, legal and professional consequences. Sometimes the most effective action is not immediate intervention, but rapid recognition, prioritization, and escalation. Effective veterinary nursing decision-making balances urgency with discipline. This means pausing briefly to assess the situation, following triage frameworks and protocols, working within scope of practice, communicating clearly with the veterinarian, prioritizing actions that protect airway, breathing, circulation, and safety. It also means recognizing that observation, preparation, and escalation are actions, even if they don't feel dramatic. You can reduce the impact of action bias by using structured approaches such as primary survey principles, verbalizing concerns to the team early, asking yourself, is this the most important action right now? Checking protocols before intervening, supporting each other to slow down and think under pressure. Team communication is especially important. A quick, clear handover or call for assistance can redirect effort toward the most effective response. Veterinary nurses play a critical role in emergency care. Acting quickly saves lives, but acting thoughtfully saves more. Recognizing action bias helps you make safer decisions, protect animal welfare, and support your team. Sometimes the best action is not doing more. It's doing the right thing at the right time.